Right. Hi, Nandita. Hi, everybody.
Hello.
Hi, thank you for having
Hello.
me. Hello. One request is that if you all are okay and you're okay to turn on the video, I would love to see you all so that I don't feel like I'm just speaking to a blank screen. So if wherever you are, if you could turn on your videos, that would be great. Even if you're just sitting on the couch or the chair, absolutely fine. Thank you. Nice. Okay, so we will keep this interactive. I understand that you're all, coming on, joining the session from your homes. You've taken your Sundays off, right? Taken in some time to do this. And even before we start, so the session today is about clinical yoga therapy for mental health, right? And we're going to explore, we're just going to go into understanding what clinical yoga therapy today is, and especially in the context of mental health. Right? So, let's do that. So to just give a background is that I have been working in this space for about 10 years now. My research work was also to do with clinical yoga therapy at NIMHANS in Bangalore. And I was exploring how for different kind of mental health concerns, there could be different kind of yoga interventions that we can use with evidence-based support, right? We're looking also at research angle to understand how it impacts our brain and what changes happen to us when we do these practices. So, okay, so let's. All right, so to understand, let's just start with understanding what is yoga. Right. A lot of people immediately, as soon as you hear the word yoga, say it's to do with asana or a body intensive practice. Right? While that is true, that's one part of yoga intervention only, one part of yoga practice. Because when we look classically, when we understand yoga, we call it as Ashtanga yoga. You might have heard of that term. So Ashta means 8. So there are 8 limbs of yoga, and exercise or asana is one limb of it. And there are other limbs as well, which are very important. Right. And when we talk about yoga, this is important to understand because yoga is not just physical practice. Right? It's not come on the mat, do Surya Namaskara and go back. It is not that. So it has other components. What are these other components? It starts with Yama and Niyama. Yama and Niyama are our living philosophies. Right? We talk about, so Yama and Niyama has certain do's and don'ts that we as individuals need to practice to live in harmony with ourselves and with the society. All simple things like maintaining cleanliness, having this sense of gratitude, right? Or how we should be as individuals with following social norms, being kind to others. These are certain principles that's outlined in yoga philosophy. Then comes our asana practice, like one of you said, right? It's to do with physical body. There's breath work, pranayama, and the other 4 that is on the other side of the screen, these are more of introspective practices when we look at yoga, right? So it's very closely, you can say, linked with modern psychotherapy concepts, right? Pratyahara, dharana, all of this is internal reflection. It talks about how yoga is also looking at an inner angle for yourself. And this is something that can be practiced, also meditation and beyond that, right? So that's what yoga talks about. Now, it's also important for us to understand the difference between a general yoga class versus a clinical yoga therapy class, right? Because a lot of people that I speak to also, when I say, or when the psychiatrist says practice clinical yoga, they say there is a yoga class near my house. I will go to that yoga class and do it. But important to understand is that not everybody would be trained to teach somebody with a mental health condition. So it's important to understand the difference between a general yoga class, which is for people who are well to do, who are healthy. Just a general example is if somebody has diabetes and you go in, right? So there's a way of treating diabetes. You may be put on medication. You may be asked to change your diet. You may be suggested certain exercise routine, right? So that you get healthy first. So similarly, even for mental health, right? If we are going through depression or anxiety, some practices may be very contraindicative. So I can't just ask you to sit quietly and say, close your eyes and meditate. Right? It can be very contraindicative. So it's necessary that we understand this difference of what clinical yoga is and a teacher who is trained and understands mental health to guide you versus somebody who's doing it as a regular yoga class. Right? So in a general yoga class, it's a holistic practice, whereas this is therapeutic. It needs somebody with an understanding of your medical background who understands mental health. Right? And the goal here is again in clinical yoga therapy is to address that particular underlying concern that you have. It may be anxiety, it may be depression, it may be stress, right? But we have to understand that first and then modify and curtail practices to support that. Yeah. And it's important to understand this because a lot of times, if we end up doing the wrong practice, it may cause us more distress rather than taking us into the journey of recovery, right? Small example, like I said, is a lot of times we say that it's contraindicated to sit quietly and go into that state of meditation if you're going through anxiety. Because naturally, what will happen? If you're already stressed and I tell you sit quietly, the negative thoughts increase, right? It can become more and more, and we don't want that. So there are certain techniques to curtail that and manage that as well. Yeah. So the approach also in what we are looking at here in a general yoga class, it may be in a larger scale, all of you do the same thing. Whereas here it has to be individualized. Somebody has to understand your goals, your concerns, and then we specifically tailor make that program for you. And this is evidence-based and supported. It also has a lot of rooting in our traditional system with regard to mental health. It also has backing with research work that is currently undertaking, right? So, yes, and this is something I always emphasize in my talks, saying that yoga is not exercise. Yoga is not a physical practice because it's much more than that, and the scope of it is much larger than just a physical workout or an exercise. Yeah. And the essence of it is how it translates into the rest of your day as well. Right? If you're practicing yoga, I would say you're practicing now the whole term of mindfulness that's there, right? So I'm being aware of everything. That's what yoga is about. Okay. So let's say, I think it's natural, right? We all go through these emotions. There are feelings that through the day we might feel anxious, frustrated, stressed, and tired. And let's understand this. Now, when we go through these emotions, um, have you noticed when you're really stressed and worked up, how is your breath? Or when you're very angry, have you noticed your breath at any time? We know that when there is an association and connection with how I'm feeling, and it's usually reflected in my breath, right? We understand that. You've told me yourself. When you're disturbed or angry, breath is fast, shallow. We understand. When you're calm, you know that breath is also relaxed. Now, I can use my breath as a very effective tool to change how I'm breathing. So then the inverse is true, right? If I change how I'm breathing, I have a little control over that. I can immediately start to see a change in how I feel. Yeah. And that can be the central theme of the entire breath work and yoga work that we do as well, because I understand that my breathing affects my mind. So I can't immediately change how I feel, but the magic tool here is my breath. I can exert control over breath. I can change how I'm breathing. Yeah. And we'll do that today and we'll see how we feel. So we know that the breath and the mind is closely associated that way, right? And okay, so then what about the body? How is my body? Okay, so if you can take a picture, if you can look at this picture here, how is my mood in my body? You can see the first picture. How is it? So when you go up, like when you're feeling at the top of the world, right? Or when you're very joyful, and even if you see children, what do? They put their hands up and they're jumping, right? They open, right? They open up their chest. So what is happening naturally? How's the body as well? As soon as I'm happy, right, I'm opening my chest. My body automatically takes on that posture where I'm feeling joyful. My chest becomes open. Yeah, I jump out. These are natural ways of how we actually respond to emotions. Yeah, and you can see the second picture. What happens when I'm feeling very low? I'm very sad, right? Automatically your spine curls. I'm going to sit down. I want to shut myself from the world. I'm going inwards. The body supports that, right? It's also look at the posture. The body is saying, I know you're feeling heavy to the heart. It's actually a protective mechanism. The spine is hunching to protect the heart. It's saying, I know you can't breathe that much. So my body is supporting me. I'm saying my mood is bad. I'm supporting you. I'm going to hunch my spine, right? So the body is also very intelligent in understanding how we are feeling with our emotions, right? So what am I doing again here with yoga? I'm using my body as a tool because I may not be able to shift how I'm feeling immediately, like I said, right? Right? But I can use my body. Now, if my body is closed, I know I need to open my body so that I feel better, right? So then what are the postures that I can do? I need to work on opening my chest so that I feel more full, right? So these are ways that we integrate body and breath work in order to have a shift in how we are feeling with regard to our mood, right? So the same thing that is here as well with breath and mood. We already spoke about it, right? We know that it has a direct association with my mood. My breathing has a direct impact on my mood, right? And we're going to use this again, great tools, right, to have and to immediately feel better. Okay, so moving on to that, we're looking at how clinical yoga therapy can help in bipolar disorder, right? And there are certain things that we have to take care of because we have different episodes, right? Like I said, it could be something to do with maybe you're going through a depressive episode currently, maybe it's a maniac episode, maybe there is anxiety. So there are certain things to keep in mind uh, when you're going through these different phases and to practice under caution. Okay? And let's just understand why this is important is that research has shown us that by practicing these techniques with clinical yoga therapy, there is a lot of difference that we've seen in about 3 months of practice before and after, right? And we've seen these changes to show in the brain with fMRI studies. We've seen it to show in the heart health, in our immunity, and all of this is integrated and connected. And we've seen that evidence-based changes happening, right? Especially there is a lot of research work that talks about yoga and depression and how that there is a shift in a lot of brain functioning, the neurotransmitters responsible, right? Something called as BDNF. There is also a change in our dopamine, serotonin, all of that that's depicted, right? So practicing this, so there are a few research studies as well, some of these that I have stated here, which look at how yoga helps elevate symptoms of bipolar disorder with impulsivity, maybe with depressive episodes. It talks about also symptomatic relief that's there when it's practiced. There was one yoga study which was done for 10 weeks of hatha yoga practice, asana, pranayama, and guided relaxation based techniques, right? And it's shown a development in symptomatic scores. So a lot of research backing is now also happening to understand how it impacts us in our overall health and mood, right? And when it comes to clinical yoga therapy, this is something that my research work looked at. And because we were looking at yoga as a holistic intervention, not just like an exercise regime, these were the components under the yoga therapy that came out in my research study. So we looked at yoga practices, that is, like you all said, asana, breathing, meditation. We looked at counseling, yogic counseling. We looked at even intervention lifestyle wise, right? What can be done for sleep, for your diet, because it requires an overall care. It's not just symptomatic relief. Take this, it's done. It's ultimately what we can do overall to improve the quality of our lives, right? And it's something that can be tailor-made for each individual. And we looked at this in the study. And what we will do today is I would actually like to give you a few tools that you can practice as well on your own. And we're going to do that practice today, all of us together, right? And you can do this sitting on the chair. So if you're sitting on the chair, let's sit on the chair and do it. And I would request you all to keep your camera's video on if you could, so I can give you a good feedback. It'll also help me see if you're doing it correctly. And we can all do that together. So I'd request you to turn on your cameras and you can just sit on the chair like how I have. So if you have a chair, you can just sit on the chair and we'll do our practice here. Okay, so to start with, I want you to sit comfortably. Keep your palm facing on your thigh, right? And make sure that your feet is in contact with the ground. So you're sitting straight with your feet touching the ground. Your palm is facing upward on your thigh, right? And just close your eyes there. And you're sitting back, so your lower back is supported on the chair. You sit back fully, close your eyes there, and take a moment. Stay with my instructions here. As you sit comfortably, I want you to close your eyes, let go of your shoulders, relax your neck. Keep your eyes softly closed. As you stay here, I want you to move your awareness through your entire spine, starting from the tailbone. Take your awareness all the way up through the whole of your spine, back of your neck, and the crown of the head. I want you to imagine a thread moving through the whole of your spine here. And imagine this thread has a two-way force. Okay, so from the tailbone, it is pulling you down to the chair, rooting you down to the chair. And then this thread is moving all the way through your spine up. And from the crown of the head, imagine this thread is pulling you up towards the roof. Okay, so there is a nice two-way force of this thread. And what is happening naturally is your spine is becoming taller and taller as you're sitting. Don't change anything. When the spine becomes taller here, just notice how you're breathing today at this moment. Don't change anything. Observe the pattern of your breath here. Is your breath deep or shallow? Is it fast or slow? Towards the end, we'll again observe and compare. So just make a note of it. Now from here, we're going to shift our awareness to the mind, preparing for the practice today. We are going to coordinate our breathing with the movement and enjoy the breath work in the next few minutes. We're going to set that as the intention. We'll start with 3 omkaras here. You can feel free to chant with me or else just listen to the vibration of the chant. We'll bring the palms together to Namaskara Mudra, breathing in. Om. Inhaling deeply here. Om. One more time, breathing in. Om. Wonderful. Let's slowly release the hands down. Eyes gently open. Okay, let's now come up to standing. We'll do a practice standing up with our breathing. I'll just show you and then we'll do it together. So what I want you to do is interlace your hands this way and bring it to the chest. Okay? And you're standing nice and tall. So what we are going to do is as we breathe in, we are going to lift the hand up all the way, bring the biceps to the ear, palm is facing up and lengthen the spine. As you breathe out, you will bring the hand down slowly and bring it on to the chest. Okay, just this. So as you breathe in, you will lift the hand up all the way, lengthen the spine, biceps touching your ear, palm facing up. And as you breathe out, slowly bring the hand back down, collapsing it onto the chest. So we'll do it with the breath, okay? So when you're breathing in, you're lifting, and as the inhalation gets over, the hand is fully lifted up. And as you breathe out, slowly bring the hand down, collapsing it onto the chest. Very nice. Do it with the breath. Inhale, stretch the hand up all the way as you breathe in. As you breathe out, slowly bring the hand down, release it onto the chest. One more time. Inhale, and as you breathe in, you will take the hand up. When the breath gets over, the hand is fully up. As you breathe out, you will bring the hand down. When the exhalation gets over, hand is on the chest. Very nice. Now relax, release your hand down. Just take a short pause there. I want you to close your eyes immediately and just observe your breathing. Immediately close your eyes, keep your hand free, and notice how you're breathing now. Observe your breath here. Wonderful. Okay, now as you're staying there, eyes gently open. So we're going to bring our palms in front of each other. Like this is going to be like you're hugging somebody, okay? We're opening the chest. So as you're breathing in, you're going to open your hands like you're going to hug somebody, right? Open the chest fully. And when you're breathing out, I want you to bring your hands closer and bring them together and relax. Nice. So inhale, open your hands, breathing in. Exhale, slowly bring the hands closer, relaxing your upper back. Nice. Inhale, open your arms like you're going to hug somebody, breathing in. Exhale and down, bring it together. Inhale, opening and breathing in. Exhale and bringing the palms together. Beautiful. One more time. Inhale to open your chest like you're hugging somebody, filling all the air within. Exhale slowly and gently, bringing the palms together. Relax, release the hand down there. Take a moment. Close your eyes. And I want you to stay with your breath. Stay with your breath there and see how you're feeling. Now let's come down to sitting. You can sit on your chair. Okay, so we'll go ahead with the next set of practices. You all can sit down on the chair as you are. Right, and sit comfortably with your back towards the chair, the lower back supported. Keep your palm facing upward. Okay, so now we're just going to do a couple of practices sitting on the chair. And a few things to keep in mind is that we're not exerting the breath at any time. So I don't want you to, right? Don't do that. The breath is always relaxed. So you're breathing in and out comfortably. There's no sound when we are breathing in and out, because if there's sound, it means that you're putting in effort and we don't want that, right? Don't hold your breath at any time, and we'll just keep the breathing nice, continuous, as it is, right? And just observe and enjoy the breath as it is. Yeah. So I'll invite you all to sit down. I hope I'm audible now. You can keep your palm facing up on your thigh. Keep it on your thigh there. Relax, sit back. Back is supported to the chair. And just stay with my instructions for the next few minutes. You can keep your eyes closed here. Allow your breath to find its own rhythm and pattern here, right? As it is today. I want you to bring all your awareness to the tip of your nostril. Okay, just become aware of the edge tip of the nostril. As you're inhaling, become aware of the air brushing the nostril. Start tracing the path of it. See how it is going further down your throat, further down all the way through the lungs, and maybe even reaching the belly. And as you're breathing out from the belly, the breath is moving up and up and up to the lungs, chest region, moving out through the throat, the entire nasal passage, and brushing out to the nostril. Just trace the path of your breath this way for a couple of rounds. As you're breathing in, the breath is moving in through the tip of the nose, entire nasal passage, throat, chest, belly. Then again, as you breathe out from the belly, chest, throat, the nasal passage, and out through the edge and tip of the nostril. Notice how as you're breathing in, the air entering the nostril is slightly cooler. And as you're breathing out, the air may be slightly warm. Notice this difference in the temperature of your breath. Wonderful. Just by observing the breath, you may notice the changes that come about in your breathing. Allow it to be. The breath may slow down. Relax. We'll gently move ahead with the next practice now. It's called Nadi Shuddhi or alternate nostril breathing. This is again a great practice for us to bring in emotion balancing, right? So if you know the practice, you can continue to do it with the instructions. Otherwise, you can open your eyes and we'll do it together. Right? So to start with, we adopt a mudra. So my right hand is open. I fold the first two fingers of my right hand. Okay, so we use the thumb and the ring finger here for this pranayama. Okay, and we'll do this together. So with my right thumb, I'm going to close the right nostril. Yeah, so I use the ring finger and the thumb like this. So I close the right nostril, inhale through the left nostril here, fully breathing in. I close the left nostril and then breathe out through the right. Again, inhale through the right nostril. Close the right nostril and breathe out through the left. This completes one round, okay? So all you have to remember is each time after you breathe in, you will change your nostril. Yeah, so we'll continue to do that, inhaling through the left. Close the left, exhale through the right. Again, inhaling through the right. And then close the right and exhale through the left. We're going to continue to do this. You can do it with your eyes closed and slower the better, right? Enjoy the slowness of the breathing that's coming about. No other part of the body is moving, only your breath is moving in and out. Keep your spine straight, your neck relaxed, and let's continue the practice. Enjoy the slowness of the breath and enjoy the rhythm that's automatically happening. You don't have to force the breath at any time. Keep it gentle. There's no sound when you're breathing. Slower, the better. Enjoying that slowness in your breath. Making this your last round. After you breathe out through the left nostril, we will stop the practice gently. And just stay there and just observe your breathing now. Don't change anything. Notice your breathing here. So by doing Anulom Vilom, alternate nostril, we are balancing the emotions on both the hemispheres of the brain that starts to work as well. The right and the left. So there's a lot of balancing that comes in. Nice. Now moving ahead with the next pranayama, which is also very effective. We're going to do Brahmari or humming bee breath. Right? So for this, we breathe in through the nose as we are. While breathing out, you're going to do a sound of a bee, bumbling bee. Right? And let's keep the eyes closed. Just see what happens around your face and head region as you do the practice. Okay, take a nice and deep breath in as you are. Breathe in. Inhale deeply. Inhale deeply. The last round, breathe in. Relax completely. Just take a pause there. Become aware of the changes. Just notice if there's any sensation around your face and head region. Immediately giving you the sense of calmness, relaxation. Allowing yourself to be in that state of relaxation. Grounding. This is an excellent practice. The humming practice is excellent to immediately bring in a sense of calmness. As you stay there, just notice how you're feeling now. How are you feeling in your breath? When compared to when we started the session to now, is there any difference in how you're breathing? Also become aware of your mind. I want you to notice how the mind is feeling. Take a moment there, reflect. We spoke about the association of the breathing and the mind. So let's just see if there's that connection. As your breath has slowed down, is there a difference also in how you're feeling? Okay, let's slowly come back to the body. Take a nice and deep breath in and exhale. Right. Okay, let's bring the hands together here. Namaskara Mudra. We'll end with Om and three Shantis as you are. Take a deep breath in. Om Shanti Shanti Shanti. Just take a moment there, rub your palms. Once it's warm, place it over your eyes. Right, so place the bottom of your palm on the eye and slowly open your eyes to look into the palm. Right, good. Okay, Nandita, I think.
Yeah. Raksha ma'am, just missing your last words.
Okay, no, I just said we could take in questions if there are any.
Sure.
Let's see.
So what team we can do is everyone can raise their hands, whoever a question, and then we have a few questions which have come in through chat also, Raksha ma'am. So we can start off with that. The first question was that are there any breathwork exercises that people with bipolar disorder or any mental health issue should actually avoid?
Okay, so I think if there are other comorbidities, right, fast breathing practices is something that you can avoid. Whatever we did today, the Nadi Shuddhi and the Brahmari, these two practices are safe for you to do at any time, and we can do that.
Okay. Okay. Then another question was also on how many iterations of each breathing exercise or technique that you shared with us should be done at one go.
You can start with 5 rounds. All right, 5 rounds of each of these pranayama techniques is something you can start with till you're comfortable. That should be a good one.
Got it. And then we have a question that is there a sequence in which these exercises should be done, or we can do it in any order?
So today we've actually good question, Deva. So we've actually touched only on like very few practices today, right? And the breath work that we've done today, you can do it in that sequence. It's Nadi Shuddhi followed by Brahmari, right? Or you can start with the hand stretch that we did, go in for the Nadi Shuddhi and go for Brahmani. But in the entirety of it, yes, there's otherwise sequence, but that will require us to do longer sessions and do it in detail, right? So otherwise, for as a quick tool to take back, you can do the 3 practices we did today.
Lovely.
Brahmari is excellent for severe anxiety. What we did today, the humming breath, right? And it can, the beauty of it is it can be done any time of the day, anywhere, right? So you can do Brahmari practice anytime.
Okay, maybe the last one. There are some grounding practices which can be done daily. I believe what you shared today was also kind of grounding practice, right? So there was just a question around what can be done on a daily basis.
I think, like Nandita, you mentioned, these practices we did today are excellent. If, in the general interest and also for a short duration, what we practice today, there can be excellent grounding techniques. You can continue to do these.
Lovely. Thank you so much, Raksha ma'am, for joining us today. She holds a PhD in clinical yoga therapy from NIMHANS. She has founded DHI Life as a holistic mental health initiative. And this is where I believe you're practicing as well, Raksha ma'am, right? So, what Raksha ma'am is practicing is integration of yoga philosophy and ancient text with mental health to complement their mental health therapy. And she has double masters in psychology as well as in yoga therapy, so nobody more qualified than her today for take this session. She has over 10 national and international publications on yoga and mental health, which is a testament on how well qualified and well knowledgeable she is on this topic. And I think whatever session was being taken today, it is one of the most helpful sessions that our peers would come across. She started off with like a comparative summary on what general yoga is, and then what is clinical yoga, what is the careful consideration being given for clinical yoga for mental health. She touched upon the mind body connection, which I think is coming more and more now into the spotlight. People are becoming more aware about the mind and body connection. How does your mood influence your bodily functions, and it affects the posture as well. And then the linkage on how there is a research backed evidence that yoga and your posture and the actions that you do has a positive effect on your mental health. So then we discussed techniques like breath work. There were mood lifter asanas like spinal movement, hands in and out breathing, and ankle stretch breathing. And then there were, and these expansive postures basically mimic the expansive mood, and therefore it positively affects and uplifts your mood if you are, you know, in a down energy state. And then we discussed the practice of tracing the path of breath. We did the nadi shuddhi pranayam, we did the brahmari pranayam. And the audience also, thank you so much everyone for an engaging session. You followed the practices along with Dr. Raksha, and you learned them in easy to follow steps. Thank you, ma'am, for graciously answering all the questions from audience as well. It was an excellent session and so well worth our time. Thank you so much.